Hello, my name is Peyton Hermisdorf, and today I will be presenting a family addiction case study based on the Netflix series Maid. This presentation is for my Addictions Family Counseling course, HUS4442, at Indian River State College. I am currently enrolled in the Bachelor of Science in Human Services program with a concentration in Youth and Family Studies. In this presentation, I will discuss the addiction issues present within the family system, identify family roles, examine potential interventions, and discuss barriers counselors may face when working with this family. Using concepts from addiction and family counseling, we will look at how substance abuse and mental health concerns impact not only the individual, but the entire family system. To begin, I will provide a brief overview of the family featured in Maid. Maid follows Alex, who's a young mother leaving an emotionally abusive relationship while trying to provide a stable life for her daughter, Maddie. Throughout the series, we see addiction, trauma, mental health concerns, poverty, and family dysfunction impact multiple generations of the family. The show demonstrates how addiction affects not only the individual struggling with substance use, but also children, partners, and extended family members. One reason I chose this show is because it provides a realistic example of many concepts we have discussed throughout this course. Maid is an excellent example of addiction as a family disease. The series shows family roles that develop around addiction, including the hero, the child affected by addiction, the addicted family member, and the enabler. The show also highlights trauma, codependency, domestic violence, poverty, and social justice barriers. Finally, it demonstrates intergenerational family patterns and how unhealthy behaviors can be passed from one generation to the next. The first family member we're going to meet is Alex. I would identify Alex as the hero or caretaker within the family system. Throughout the series, Alex takes responsibility for everyone around her. She works multiple jobs, cares for Maddie, attempts to manage Paula's crises, and often puts other people's needs before her own. Alex also demonstrates parentification, meaning she frequently acts more like a parent to her mother than a daughter. Maddie represents the child affected by addiction and family dysfunction. Although Maddie is not struggling with addiction herself, she experiences the consequences of addiction through the adults in her life. She is exposed to instability, conflict, financial hardship, and trauma. This highlights an important concept from Chapter 1, which is that addiction impacts the entire family system, including children. Sean is Maddie's father, and he's one of the primary addicted family members. Throughout the series, Sean struggles with alcohol use disorder. He often uses alcohol as a way to cope with stress, frustration, feelings of failure, and emotional discomfort. His drinking contributes to relationship problems, poor decision-making, and difficulties in his role as a father. Paula is another addicted family member who is Alex's mother. She demonstrates chronic alcohol misuse and significant mental health concerns that appear consistent with untreated bipolar disorder. Paula frequently uses alcohol to cope with emotional instability and stress. Her substance use contributes to unstable relationships and creates significant challenges for Alex. This is Alex's father, Hank, who represents the enabler role. Instead of addressing problems directly, he often minimizes or ignores unhealthy behaviors. This allows for dysfunction within the family system to continue. Enabling is common in families impacted by addiction because family members may try to avoid conflict to protect relationships. The primary addiction addressed in this family is alcohol use disorder. Paula uses alcohol to cope with emotional instability and mental health symptoms. Sean uses alcohol to manage stress and feelings of inadequacy. The family experiences numerous consequences, including trauma, poor communication, financial stress, and the parentification of Alex. Chapter 1 describes addiction as a family disease because it impacts every member of the family system. We can clearly see this throughout the series. One theory that helps explain this disease is the disease or medical model of addiction. This model views addiction as a chronic disease that affects brain chemistry and requires ongoing treatment and support. Both Paula and Sean continue drinking despite significant negative consequences. Their alcohol use affects relationships, parenting, emotional functioning, and daily responsibilities. This model helps us understand addiction as more than simply a lack of willpower. Another theory discussed in our course is the ABC model. The incidents for Sean and Paula include stress, trauma, conflict, and financial pressure. The behavior is drinking alcohol. The consequence is temporary relief from emotional pain and stress. Although alcohol provides short-term relief, it ultimately creates additional problems and reinforces the addiction cycle. Carnes' addictive system helps explain the thought patterns that support addiction. For Paula, her core belief may be, "I'm not good enough." This leads to impaired thinking, such as believing alcohol is the only thing that helps her feel better. For Sean, a core belief might be, "I am failing as a father." This leads to impaired thinking, such as believing he deserves a drink after a stressful day. These beliefs contribute to rituals, compulsive drinking, shame, and continued addiction. If this family entered counseling, several assessments could be used. The clinical family addiction assessment includes the identification phase, introduction phase, strengths assessment, addiction history, reestablishing phase, and conclusion phase. Additional assessments could include the audit, which screens for alcohol misuse, the CAGE questionnaire, the ACE questionnaire for trauma history, and the family assessment device to evaluate family functioning. These assessments help counselors identify strengths, challenges, and treatment goals. Chapter 4 discusses the sequential family addictions model and the stages of change. Alex appears to be in the action and maintenance stages because she's actively working to create a healthier life for herself and Maddie. Sean appears to be in contemplation because he recognizes some consequences of his drinking but struggles to fully commit to change. Paula appears to be in pre-contemplation because she often does not acknowledge the severity of her alcohol use. And Hank also demonstrates that he's in pre-contemplation because of his resistance to change by minimizing family problems. Motivational interviewing could be very effective with Sean and Paula. This approach uses open-ended questions, reflective listening, and affirmations to help individuals explore their ambivalence towards change. For example, a counselor might ask Sean, "What would your relationship with Maddie look like if alcohol no longer controlled your choices?" This encourages Sean to think about his values and reasons for change rather than being told what to do. Solution-focused family therapy focuses on strengths and solutions rather than problems. One intervention is the miracle question. For example, if addiction had disappeared tomorrow, what would be different? Another intervention is the scaling question. A question like a question in the realm of a scaling question may sound something like, "How confident are you that you can stay sober this week on a scale of 1 to 10? This approach builds hope and helps clients focus on small successes and achievable goals. Structural family counseling improves or focuses on improving family relationships and boundaries. One intervention is boundary setting. For example, Alex would learn to stop taking responsibility for Paula's drinking and choices. Another intervention is family mapping, which helps identify unhealthy roles and interaction patterns. The overall goal is to create a healthier family structure with clearer boundaries and responsibilities. Cognitive behavioral family therapy focuses on changing unhealthy thoughts and behaviors. For Sean, a counselor might challenge the belief that alcohol helps him manage his stress. For Paula, a counselor might challenge the belief that alcohol is the only thing that helps her feel better. The therapy would also focus on communication skills such as active listening, conflict resolution, and assertive communication. The goal is to replace unhealthy thinking patterns with healthier coping skills. Chapter 7 focuses on family of origin influences. Throughout the series, we see how Paula's instability impacts Alex. Alex's experiences then influences how she parents Maddie. We also see how Hank enables dysfunction within the family system. These examples demonstrate how trauma and unhealthy patterns can be passed from one generation to the next if they are not addressed. Several barriers could interfere with successful treatment. For Paula, barriers include alcohol dependence, untreated mental health concerns, and financial instability. For Sean, barriers include denial, defensiveness, and alcohol dependence. For the family as a whole, barriers include trauma, trust issues, poor communication, and resistance to change. These challenges would need to be addressed throughout the counseling process. Maid highlights several important social justice issues that affect families impacted by addiction. Throughout the series, Alex faces poverty, housing insecurity, domestic violence, and limited access to resources. Even though she's working hard to provide for Maddie, she struggles to find affordable housing, reliable childcare, transportation, and financial stability. The series also shows how people can become trapped in unhealthy situations when support systems are difficult to access. Alex often has to navigate complex social service systems while trying to keep herself and her daughter safe. These challenges demonstrate how factors such as socioeconomic status, access to healthcare, and access to community resources can significantly impact a family's ability to recover and heal. As counselors, it is important to recognize these social justice concerns and understand that addiction and family dysfunction do not occur in isolation. Addressing the family's needs requires looking beyond the addiction itself and considering the environmental and systemic barriers that contribute to their struggles. In addition to counseling and family therapy, it is important to connect families like the one in Maid with wraparound services that address their multiple needs. Addiction and family dysfunction often affect housing, employment, mental health, childcare, safety, and social support, so recovery requires more than just therapy alone. For Sean, resources such as Alcoholics Anonymous and Substance Abuse and Mental Health Services Administration Hotline or Helpline can provide ongoing support for alcohol recovery and treatment referrals. Paula could benefit from mental health counseling, psychiatric services, and community support programs to address her emotional instability and substance use concerns. For Alex and Maddie, safety and stability are critical. The National Domestic Violence Hotline can help individuals experiencing abuse access safety planning, shelter services, and advocacy. Local organizations such as Tykes Teens provides mental health counseling and support services for children, adolescents, and families. Families can also access community resources through 211 Treasure Coast and the United Way 211 Resource Network, which connects individuals with housing assistance, food resources, childcare, transportation, healthcare, and crisis services. Additional treatment options can be located through the Substance Abuse and Mental Health Services Administration Behavioral Health Treatment Services Locator. These resources demonstrate the importance of a wraparound approach where counseling is combined with community support systems to help individuals, families, and children achieve long-term stability and recovery. In conclusion, hold on. There we go. In conclusion, Maid provides a powerful example of addiction as a family disease. The series demonstrates how addiction impacts multiple generations and influences family roles, communications, relationships, and emotional well-being. Using theories and interventions from this course, counselors can better understand families like Alex's and develop treatment plans that address both addiction and family functioning. Thank you for your time.